First of all, good afternoon. I'm Delegate Tony O'Donnell. I'm the Minority Leader of the Maryland House of Delegates, and many of our members are with us here today. As you all know, we have been talking about health care reform in this nation for certainly the better part of the last 2 years. It's been very well debated, very well discussed, very well vetted, culminating in the passage of legislation at the national level. The states are trying to now figure out what that means, what's contained in the bill, what the mandates are, and what the implications are for the state. So the Republican caucus, our 43 members, have some thoughts about this and some very specific ideas and pieces of legislation that we wanted to offer to you now. So we're going to talk about the need for principles and first priorities, and then we'll have some presentations. But here's the overriding message. We think Maryland needs to slow down on its implementation of the National Health Care Bill. It's referred to as Obamacare, but whatever you call it, the National Health Care Reform Law that passed needs to take a deep breath in the state of Maryland until other things are figured out. For instance, this law is in the courts. It's being challenged on constitutional grounds. And we need to know that if we're going to spend taxpayers' money, both federal taxpayer dollars and state taxpayer dollars, that it's not going to be money thrown after a futile attempt to implement this thing if it's going to be struck down the courts on constitutional grounds. Two, we're very dubious as to whether or not this Congress, this current Congress, or future Congresses will adequately fund some of the provisions of this health care reform, and therefore the states need to slow down in terms of what we can afford to do and when we can afford to do it. We have until 2014 to implement most of this, and therefore I think because we're trying to fill a $1.6 billion budget deficit this year, that we shouldn't be spending money on implementing a new series of programs, creating new bureaucracies that we may not need in the long run if this stuff doesn't come to fruition and it's struck down in the courts or doesn't get funded. So as a matter of first course, we advocate that we slow things down in Maryland. Governor O'Malley and his administration, through their review commission, which is, by the way, had no Republicans on it, have advocated expedited implementation, and they have bills in this year to expedite that implementation. We think that that is ill-advised at this point. However, if we are going to implement, if we are going to move forward, we believe that we have the right priorities and a set of guiding principles that we'd like to share with you and some thoughts.
Maryland can't afford to spend millions of dollars on something that's unconstitutional. They should know better, and it is a waste of taxpayer dollars to proceed forward on this. Let's let the federal case resolve the question, and once that's done, then we can do what's necessary with making sure that health care is available to as many people as possible in a constitutional manner. Thank you.
This is Obamacare, as was passed last year. As you can see, it's a spider web of bureaucracy that really stands to bankrupt our country and ruin a high-quality healthcare system that we have in the country. We, as the Republican Party in Maryland and the House Minority Caucus, have a set of principles that we believe can take what was attempted last year and improve the reform efforts here in Maryland. Maryland has a very strong safety net for folks in poverty and folks without the ability to provide for their care. And we're a very generous state. We have some of the highest benefits in the Medicare program nationally. We've advanced Medicaid expansion, and we've done that all in a real bipartisan fashion, which interestingly did not take place in Washington, D.C. last year. So with this as our fear of what could come from Obamacare in Maryland, we've outlined a set of principles and policies that we've worked very hard developing. Every member of the Health Committee is here today with a set of principles. These principles include medical malpractice reform, the expansion of electronic health records, transparency in the process for the implementation of the Governor's Healthcare Exchange. We want to make sure that the exchange is subject to the Open Meetings Law, They have the availability for scrutiny. Most importantly, we don't want to see this become a new bureaucratic agency that sucks healthcare dollars out of the system, raising costs, whereby lowering, and in the end, lowering the actual healthcare quality in the state.
We Republicans recognize that any attempt to reform the healthcare system must include serious medical malpractice reform. We're losing doctors at an alarming rate to other states. We're graduating doctors from our medical schools in Maryland who are shunning high-risk specialties, and obstetricians are paying more than $150,000 a year just on medical malpractice insurance. And if you do the math, you have to deliver an awful lot of babies just to cover that $150,000 annual bill. Doctors are playing defensive medicine. They're ordering extra tests and procedures which all drive up the cost of medicine and healthcare for everyone. So we support several actually common sense ideas like, number one, structured settlements. When there's a judgment made in a medical malpractice settlement, the payments would be spread over a multi-year period instead of all at once, thus lessening the financial burden. And that just makes common sense to us. Secondly, an apology exception. If a doctor issues a sincere, "I'm sorry," or "I regret that this outcome is not perfect," in a very sincere and humane way to the patient and his or her family, we believe that that kind of expression of regret should not be used in a court of law against that doctor. Yet again, another common sense approach. We also believe we should be looking into health courts. These are specialized courts that give judges who hear these cases some expertise and education and experience in these very complicated medical malpractice cases. And then fourth, the cap on non-economic damages should stay. We currently have a very sensible cap at $650,000 for pain and suffering in the state, which makes sense with the $15,000 annual escalator clause. We would not want to see that go. We think that makes sense to keep it that way. So the Republican caucus is united with these principles that we've outlined today. The need for medical malpractice reform is very important. It's at the forefront of this issue.
Very much. I'm here to talk today about electronic medical records or health information records. And I think we universally agree that we need to change the way that we take care of our health records. Right now we have a paperweight-based system in every doctor's office and every hospital. And there's uniform agreement that we need to streamline this. And Maryland is on the forefront of this. We've got a group that's been meeting for the last 2 years. We have 46 hospitals have signed letters of intent, and 20 of them already on board with electronic medical records, and finding a way to coordinate that to reduce patient errors, make sure prescription errors are reduced, improve quality, and have all the medical information in one place. We also are going to have advanced directives on your medical records, and the big hurdle that we're trying to make sure we have is patient ability to say no to who sees the records. So that is the one problem that we have to overcome. But it will link all the physicians, private physicians, and the hospitals. Nurses, payers, and health plans will all be on your medical records. And we have moved forward with the principles of this in the state of Maryland. And this caucus is supportive of that. And we have to make sure that it's consumer focused and privacy and security is number one, so that only people that are allowed to see the records can see them. So electronic medical records is going to be a huge part of healthcare reform across this nation, and Maryland is on the forefront of that.
If there's one thing that all of our constituents, I believe, across party lines can agree on, is that there's a need for more sunshine and openness in our government at all times. And that's never more true than in the case of implementing healthcare reform. We believe, as a Republican caucus, that first off, the exchange and anything that we set up must be open to the Maryland Open Meetings Act. There must be ability for constituents and for us to find out what's going on and for it to be available to the press as well. We also believe that the financials of healthcare reform, any exchange, anything we set up in the state of Maryland, the financials must be open to the public and open to scrutiny from the legislature, from the press, and the public. Third, we believe that the appointments to the boards that are involved in this venture need to have legislative consent, advising consent. And fourth, we believe that the exchange needs to be fighting for consumers, for the best deal for consumers. There should be a firewall established between special interests and the board. And so we need to have plenty of input from the consumers, those who are affected by healthcare.
There's an 800-pound gorilla in the room, and this delegate is standing in front of me, something right there. That is Governor O'Malley and the leadership of the Generals. That's their dream, right there. And what we must make sure does not happen is that the Obamacare nightmare, if it does go forward, is not transformed in the state of Maryland, where the policy officially here is big government and bureaucracy, does not turn into this.
Our concern is that the exchange, which will basically either hire or an individual called a navigator, we're concerned that those navigators, which will be probably government trained, are going to be taking the place of private sector insurance agents. And so one of our principles is to make sure in any exchange bill that passes that there's a place for people who currently sell insurance in the private sector.
We're going to advocate in this legislature for policies that you can take with you from job to job. We don't want to see anybody go without health insurance because they were to lose their job or move on to a new career. We believe that the policy should be focused on the individual, their family needs, and we believe we can implement that in Maryland. A big portion of that is a health insurance policy through a small business as after-tax dollars. So they get a tax break if they buy the insurance through a small business. An individual who purchases health insurance for themselves don't necessarily get that benefit, so it's more costly from a tax perspective. We want to implement and advocate for changes to that system so that the individual can get the tax credit as well.
But where something hasn't been said is, where are we getting the money to implement this plan? And I'll tell you where we're getting the money. The federal government has given us $100 million to implement this plan. And I said 100 million. And in committee, we're just addressing about $1 million of that 100 million and setting up these
So this concludes our presentation on the Republican caucus's position on health care reform in Maryland. We very much want to ensure that the citizens of Maryland do not end up with a system that looks like this.